Hi everyone, I have another exciting case to share with you today. Take a moment to look at this panoramic radiograph which was taken on a 16-year-old patient. Let me adjust the contrast a little bit and tell me if you see or if you have an area that you're concerned about primarily in the sinus area. I'm sure you can find one or two things that you may be worried, but let's pay our close attention to the maxillary sinuses. Do you see that there is a well-defined, a dome-shaped radial opacity within the left maxillary sinus? So let's figure out what this opacity may be. Before doing that, let's identify some structures in the maxillary sinus. A very dense opaque line that is horizontally extending in this direction represents hard palate. Over here represents the medial wall of the maxillary sinus, and here we have floor of the maxillary sinus. And starting here, what we're seeing is the posterior wall of the maxillary sinus. So here we have posterior wall and the floor of the sinus. Then what is this opacity? Which is located directly superior to the maxillary first and second molars. So that represents zygomatic process of the maxilla. If you guessed that, that's absolutely correct. Now let's try to trace the border of this opacity as best as we can. So I'm following it with my cursor as best as I can, and right about here is we start to lose its opacity or its border. But if I can try to visualize its border, you may be able to see that portion of its border is extending possibly toward the floor of the sinus, but that's really hard to see and it may not show up on your video. But for certain, however, we have this radial opacity. Another important feature to recognize is that whether this one has a corticated border or it is without a corticated border. And what would you say whether this is corticated or not? A cortication to me means just like this maxillary sinus, you have to have a well-defined thin zone of opacity that has a density of a cortical bone, which in this case certainly lacks. Right? So this does not have a corticated border, and that has a very clinically important significance, or diagnostically its important significance. And also let's evaluate the radial density of this opacity. Keep in mind this opaque area is not part of the lesion or this entity, but again, this is the part of the zygomatic process of maxilla, or it is the zygomatic process of maxilla, which is a normal anatomy. What I want you to determine is whether this opacity has a density of bone or soft tissue. And what would you say that it is? One way to determine that is you have to compare that to a bony tissue or soft tissues, such as this. What is this one? Before I give you the answer, what does this opacity represent? And we can see it on the contralateral side as well. That's an earlobe, right? Portion of an ear. And to me, this overall density is much closer to soft tissue. Okay, so you have enough radiographic features to determine what this is. Can you guys guess what this might be? Another thing that might be helpful to know is the vitality of these teeth, right? Whether it's vital or not could help you to determine this opacity one way or another. It may help you to lean toward one or the other diagnosis. But given that this patient is asymptomatic and the vitality of these teeth is completely normal, what would you say this is? So I think I've delineated all the important radiographic features. So this is an example of mucus retention pseudocyst. As the name suggests, pseudocyst. It's not a true cyst. It does not have an epithelial lining, and it's mucus retention pseudocyst. So what do you do, or what do you have to do? Well, in an asymptomatic patient, generally this does not require any further treatment. It may spontaneously go away, or it may persist and stay there for weeks or months without really causing any problem. But in a symptomatic patient, I would suggest you refer the patient to an ENT physician for better evaluation. This could be surgically removed or could be managed with medications. Where this could potentially cause a problem is, say, this becomes too big and blocks the osteomeatal unit or the drainage pathway. In that case, you can see or you can imagine the maxillary sinus would be filled and will certainly become symptomatic. So that is the major learning point from this radiograph. Another side note that you may be able to see, which I'm actually going to create another full video, is if you pay close attention to the anterior maxilla and mandible, you can see that you have a much harder time of visualizing the apex of 25. So is 25 missing? Okay, you are not seeing the root of 25, right? And also look at number 9. It's endodontically treated with the some type of opaque filling area in the apex. So given what you see, what do you think might have happened? Okay, something to think about. And if you've said trauma, you're absolutely correct. Okay, so that's it on this video, or for this video, and I'll talk to you later.